Hello, welcome back to our Hospital Rounds video series. I'm so excited to welcome you to Hillsdale Podiatry today. And in every hospital, nurses and doctors have to round down their patients to ensure timely care and keep those patients in the know about their care plan and what's going on. And in the same way, we're doing that with our clinics and our departments and units to keep you, our community, up to date and in the know about what's going on at Hillsdale Hospital. Today, I'm here with Dr. Komal Patel. Thank you so much for being here with us. She is our local podiatrist. Can you please introduce yourself for our community?
Of course. Thank you so much for having me today. I am Dr. Komal Patel. I am the podiatrist here at the Hillsdale Hospital, serving the Hillsdale community.
Yeah.
I'm very excited to be here and tell all of you what I do.
Perfect. Well,
Yeah.
we're going to walk through the office and kind of talk to a few different people who are involved in the process.
Yes. So today we're at the office.
Yes.
And it's one of the outpatient service that I provide other than a number of others. So I'm here usually twice a week,
Okay.
Mondays and Wednesdays. The office is an outpatient setting where patients come in for whatever podiatry issues they have, from foot pain to ingrown toenails to hammer toe deformity or any other foot and ankle deformity that they have pain.
Wonderful.
The first process is they check in.
Okay.
Okay.
Perfect.
So this is the check-in area, the desk.
Wonderful.
And they will come and introduce themselves and go from there.
And so this is also our Hillsdale Surgical Group office, but
Yeah.
Hillsdale Podiatry kind of has different days. So when you're not here in the office, you're at the hospital, correct?
Correct.
Yeah, so surgical, tell us about that.
Yeah, absolutely. So one day of the week, I'm at the hospital where in the morning I see patients at the wound care center, where they're more acute patients who need more, closer follow-up. So I see them pretty much a weekly basis at the wound care center at the hospital. And I also operate in the afternoon on Tuesdays as well.
Okay, great.
Yeah.
And so we're going to talk more about that and go into more depth about the types of conditions, but let's meet one of your team members.
Yes.
Now we are here with Amy. Thank you for being here, Amy. This is the next step of the podiatry process. So once you get checked in, you'll come back here and you'll meet Amy. Amy, can you please introduce yourself to our community?
Yes, my name's Amy. I am a medical assistant here with Hillsdale Hospital. I have been with Hillsdale Surgical for probably about 2.5 years, and podiatry since June of this last year.
Yeah, great. Well, thank you for being here. So talk us through what the process is once a patient gets in the office and they're coming back to be roomed. What are you looking for, and what are the kinds of questions that you ask a patient?
So I would call them out in the lobby, then we go back to the room. I do get a wait first, so that's usually not the most favorite part of the rooming process, but
important.
Yes.
Yeah.
And then we just take some vitals, and then I collect some information to get the patient's chart up to date, such as history, medications, any type of things that are going on for today's visit, what their concerns are.
Yeah. And what do you find that patients normally look for in getting started? What are like the most common reasons that a patient might come here for kind of a new appointment with Dr.
Yes, so I think the two most common things are foot pain and ingrown toenails.
Yeah, so that is nasty, and I definitely wouldn't want to have to deal with that on my own. So it's really good to know that we have a full office here to take care of you and to really provide that high quality care that can. Now we are here with Dr. Patel again in one of the patient rooms. Thank you again, Dr. Patel, for being here. No Can you give us a little bit more of an introduction to your background and how you got to be here at Hillsdale Hospital, and also why you chose the field of podiatry?
Yeah, absolutely. So again, thanks for having me. So my background is I'm a podiatrist. I am actually originally from Pennsylvania, but moved here about a couple of years ago with my husband due to his job, and then I found Hillsdale community.
Yeah.
And here I am.
We're so glad you did. You've been here for about 7 or 8 months now, which is really exciting.
It is.
And I know that we've just received incredible feedback from the patients that you've seen. They love you, nothing but good things to say, and you take such good care of them. So why podiatry? Why is that interesting to you?
I think foot is one of the part of the body that is neglected. We take for granted and we don't think about it, how important it is until we're hurt.
So tell us a little bit about when you come in and see a patient after Amy has, come in and done kind of that introduction process. What are you looking for from that patient when you first walk in the room?
Yeah, so initially I would ask them, what brings them to see me
Okay.
here. And depending, a lot of the time, the common patients I see the common problem is a foot pain. And
Okay.
then we talk about it, narrow it down. Where does it hurt? How long
Yeah.
it's been hurting? And we go from there. A lot of the patients with foot pain would have chronic pain from arthritis in their
Yeah.
big toe joint or any other part of their foot. Plantar fasciitis, which is the heel pain, which is also very common.
Yeah.
Tendinitis, for Achilles tendinitis is a big one as well.
Yeah.
So depending on, first we narrow it down what hurts, and then we go and do treatment plans for that.
Okay.
That includes resting inserts, injections, also very helpful too.
Okay. Gotcha.
And if all this fails, then we talk about surgical treatment options to fix it. And there are different surgery options as well, depending on patient's lifestyle, what are their goals. So there are different surgeries depending on what is best for them at that point of time.
Okay, gotcha. Yeah. And let's talk about those surgeries just a little bit. So what are some of the different options, and what should a patient expect when they are kind of told, okay, you might need surgery for this?
Yeah. So again, I'm just going to give one example of, first metatarsophalangeal joint arthritis. Let's say if a patient comes in with that, they have a tiny little spur on the top and on the sides of their big toe joint.
Okay. Gotcha.
Usually I would, depending on their age and the goal, again, it's very important what fits best for them at that time of the period in their life. So I would either say, give them options. There's something called chilectomy, which is just cleaning up the joint and give them, a few more years to be pain free.
Okay, gotcha.
And afterwards, they may or may not need more definitive procedures such as joint replacement or even a arthrodesis, which is a fusion of the joint.
So what are the, sometimes people come to the clinic to see you, but sometimes you go and see patients in the hospital and help them. What are the kinds of conditions that might take you to the hospital to see a patient?
Yeah, so good question. At the hospital, I see more acute, injuries and conditions, such as most for foot is infections.
Okay.
It's a big one. Specifically for patients who are diabetics, who are uncontrolled, who do not have any feelings in their feet, and they step on something, and at the time they realize it, they have something, and it's swollen and draining and smells. That brings them to the hospital. And at that point, we get x-rays, get infection workup done at the hospital, and that's when they will consult me to see the patient and what they need to be done. And a lot of the time, I will say, once the patient is in the hospital for an infection of their foot, they do end up with some sort of surgical treatment procedure, which it could be as simple as IND if they have an abscess, or an amputation if there is an infection in the bone.
Yeah. Wow. So a huge range of options. Let's talk a little bit more about diabetes. What would you recommend for a patient who has, for instance, type 2 diabetes and, maybe needs to start thinking about their feet a little bit more, taking care of them? What would you recommend their regular process? How often should they see you? And what are the things that they should be doing at home to take care of their feet?
Yeah. So, whether a patient is type 2 or type 1, at some point in their life, specifically if they are above 50 at least, and their feet are okay, they can, feel their feet and no problem, but at least once a year, they should really have their feet checked with a podiatrist to make sure that they're still doing good. Having that basic education is so important for your diabetic feet, which involves, what can go wrong with them. Just knowing that basic is also very helpful to prevent diabetes-related foot complications, such as I just discussed.
Yeah. Okay. Gotcha. So it really takes maintenance, even if you don't feel like something's wrong. You should really be watching it and seeing a
Absolutely. And it can start as simple as with your primary care doctor. If you don't, life is busy, people have things to do. So if you have your primary care doctor appointment every 6 months or 1 year, every 3 months, you can just ask them can you please take a look at my feet for a second? And if they feel appropriate, primary care doctors, then they can certainly guide them in the right direction. I think you need to see a podiatrist to get your full evaluation of your feet.
Is diabetes the condition that you normally see in the wound care clinic as well, or what kinds of wounds, what kind of work do you do up there on that floor?
Yeah, so wound care, diabetes is a big one because, once the patients are diabetic, and the ones who have uncontrolled diabetes, they don't feel their feet as much, and when they have wounds, that's when I see them at the wound care center. It is more specialized clinic with a lot of dressing options and more closer follow-ups at the wound care center with me. I will see diabetic wounds. I am also seeing arterial wounds and venous wounds. So anything wound below the knee, I see at the wound clinic.
Okay. And so for a diabetic patient, let's talk about the worst case scenario.
Yeah.
So, there's surgical options, and amputation does really seem like the worst case scenario, but ultimately it's to stop that infection from spreading to make sure that the rest of a patient's health can be preserved. So, obviously no one wants to think about that, but in the case that does occur where an amputation is the next clear step forward, can you talk about the process of that and how you kind of help a patient adjust to what life looks like after that, and how they can thrive again after a surgery like that?
Yeah, so any sort of amputation is a major change in your life.
Yeah.
Right? Losing a part of you is not easy.
Yeah.
All right. So I always say this is a team approach, a team work where I am part of it.
Yeah.
Patient is definitely part of it.
Yeah.
The family is part of it.
Absolutely.
Primary care doctors are part of it. Other specialties, sometimes such as infectious disease, is part of it, as well as vascular surgery is a big part of it too.
Yeah.
Yes.
And we have so much of that here in Hillsdale. And so would you say that we have the full specialties and continuum required to deal with that all right here at Hillsdale Hospital?
We do at this time. Yes.
That's wonderful.
Yeah.
Yeah. Okay. So that's, the worst case scenario. And then there's, some lighter things like ingrown toenails, things like that. What are the treatments that you can provide right here in this room for patients who have something that isn't that severe?
Yeah, of course. So we also do, same day procedures. Like you mentioned, an ingrown toenail patient come with all ages.
Yeah.
With pain in their toenail because there is an ingrown nail infection.
Yeah.
We treat it right here. I would sometimes put, if they need it, they would be on antibiotics for a week or two.
Yeah.
And then we numb their toe to remove that ingrown nail, which is causing them pain and infection.
Okay.
That's one. And then we also do injections, depending on what patient needs it. Like I said, plantar fasciitis, heel pain. We can also give them a short, relief with an injection, physical therapy, and we go from there.
Thank you so much, Dr. Patel. It's been wonderful to have you here.
Thank you so much for having me.
So now I am here with Kimberly. She does the part of the podiatry process that is scheduling surgeries and really helping you get connected to the next step of your care journey. So thank you so much for being here, Kimberly. Can you introduce yourself to our community?
Yes, I'm Kimberly Stover. I've been here with general surgery for 30 years.
Okay.
So I do the surgery scheduling. And I've been scheduling for Dr. Patel.
Yeah. So you work on the surgical side and for podiatry, so general surgery and podiatry, which is great because it a lot of times podiatry has to kind of be part of surgical. So tell us about what the process is if a patient, maybe comes and sees Dr. Patel and then she says, okay, I really think we need to set up a surgical procedure. What happens next?
What I do is I set the patient up for the surgery. And then I will set them up with their primary physician for a medical clearance.
Okay.
So they can do the history and physical. I check to see if they need a cardiac clearance or any other clearances.
Yeah.
And then we set them up with the hospital to do pre-admission testing and post-op appointments and get them all cleared.
So with podiatry, how long is typically the wait time between an office visit and getting the surgery on the schedule?
Usually quickly. We usually try to get them in within a week, especially if most of them are urgent.
Okay.
So we try to get them in within a week or two.
Okay. Wow, that's super fast and probably really great, especially if you have a condition that is urgent and needs to be addressed. Then that's really great to know. What are the types of? Tell us about these medical clearances. What are you kind of looking for and making sure that we are all set? We know everything about a patient before we go into the operating room with them.
Usually for the medical clearances, we just want to make sure that with their medications that they're clear to undergo anesthesia. If there's any cardiac clearances we need to do, just to make sure that they can, proceed with surgery.
Yeah.
But usually, most of these are urgent, so
Yeah.
that usually it overrides needing these clearances for Dr. Patel's cases. So.
Okay. Great. Well, thank you so much for the work that you're doing and
you.
helping our schedule stay organized and getting patients booked.
Thank you.
Thank you so much for joining us for today's Hospital Rounds video. We visited our wonderful podiatry office here with general surgery in the beautiful Three Meadows Medical Building that's right in Hillsdale, very close, just down the road from Hillsdale Hospital. Thank you again for joining us. We talked to several different people involved in this process, and if you want to learn more about how you can set up an appointment, how you can learn more about the service, go to hillsdalehospital.com/podiatry. We'll provide the phone number and all of that other information in the caption as well. Thank you again for joining us, and until we see you in our next video, remember, rural health strong.